Hi Year 12. Hopefully you watched the first PowerPoint where I was going over the Unit 2 exam and the content of the Unit 2 exam and the layout. We're now going to have to recap the content from Unit 2 starting from Learning Aim A. I'm not going to spend too long on it. I'm just going to briefly go through the slides. I'm going to focus more on the exam questions that I've included within the PowerPoint. I really want you to have a go at the last question by yourself and to send that in to me. So just a reminder of the command words used in this unit and in BTEC in particular. Identify is stating facts, describing is giving a full account using the information available, and explain is making an idea, situation or problem clear. Now the questions I have included in this PowerPoint are explain. First of all, we're going to look at the roles and responsibilities of people that work in a health and social care setting, focusing on these particular jobs: doctors, nurses, midwives, healthcare assistants, social workers, occupational therapists, youth workers and care workers. First of all, everything that I talk about now will come into the healthcare workers category, and then I will focus on the social care workers. Like I said, I won't go over everything, but it's really important to refresh your memory of the roles and responsibilities of health and social care professionals. Now, a doctor is usually, especially our GP, is usually our first point of call, and they will help assess our needs. They'll have a look to see what's wrong with us, so looking at our symptoms, and then they will give advice, treatment, medication to help us get better again. So they're there to care for people that are unwell. They also provide preventative care. So for example, they may suggest people don't smoke or eat too much. They have the right to refer you to hospital specialists, diagnose illness and ailments, prescribe medication. There's not many people that are allowed to actually prescribe medication. And then they can monitor the impact of that treatment that they've given you. Doctors can also include vaccination programs, and health education on things like smoking and drinking and drugs. Hospital doctors are a little bit different than your local GP. They tend to provide more specialist medical care. A consultant is usually a specialist in their field, such as a cardiologist, and they normally lead a team of junior doctors. Below is a list of consultants such as cardiologists, heart disease, psychiatrists, mental health. It's really important to refresh your memory of all the different types of specialists that are available in hospitals. Here we have nurses. They are, as we've seen through COVID-19, so important. The largest group of professionals working in health and social care services. Adult nurses, I apologise, work with adults of all different ages and all different health conditions. Nurses can be based in hospitals, clinics, GP surgeries. They can work with people in their own homes, district nurses. They help plan individual care, carry out procedures and treatments. Many nurses now are also trained in handing out medication. You do have to pass exams to be able to do this, but it is a process that is being taken away from the doctors to give them more time on consulting and allowing nurses to hand out medication. Mental health nurses, they focus especially on psychiatric health, mental health. They may work in psychiatric units, community health care centres, and they're there to help people with mental ill health in particular. They try to ensure that they're cared for in the communities and not hospitals. A paediatric nurse, this is a children's nurse working with a wide range of conditions found in children. They have to work very closely with parents and relatives to explain processes that the children are going through and the type of care that they're being given. They can work at home, in people's homes, they can work in hospitals. Neonatal nurses work with newborn babies, including babies who are born prematurely. Learning disability nurses work with people with learning disabilities. It can mean that they are working with children in schools or young adults in workplaces. They help to look after the person's physical and mental health, making sure that they can live as independent as possible, considering their condition. District nurses care for people of all ages, supporting them in their own home, working closely with family members. They assess the patient's needs and also care and support the needs of their informal carers. Many care for older people with disabilities and people recently discharged from hospital. Other types of nurses you may come across are health visitors and practice nurses and school nurses. Midwives play a central role supporting women through all stages of their pregnancy, both antenatal, so before birth, and after birth, postnatal care. They help families prepare for parenthood and delivering babies. They can be based in hospital maternity units, GP surgeries, and also they can be called to women's homes. A healthcare assistant. Now, these can also be called a nurse's assistant or an auxiliary nurse. They are working under the guidance of nurses. They can work in GP practices, hospitals, nursing homes. They usually work alongside qualified nurses, but they can also work with midwives. They can take and record a patient's temperature and pulse, weigh patients, take patients to the toilet, lots of personal care, making beds, serving meals and assisting with feeding. So here's an exam question from the June 2019 paper, section A. And the scenario is Jason is being treated for mouth cancer in hospital. Following surgery to remove a tumour from his tongue, Jason has eating and communication difficulties. He gets very frustrated when he cannot make himself understood. Can you have a go just making a few notes and pausing the PowerPoint to do this, of explaining the responsibilities of a healthcare assistant who cares for Jason? Once you have made some notes, you can move on to the next slide. But don't cheat, don't move on already straight away. Do actually make some notes before you move on. So if you'd paid attention to the slide before the exam question, you would have seen some of the roles and responsibilities that healthcare assistants are expected to carry out. Now, the exam paper have said that, the exam board have said on this paper that the answers they've suggested are not an exhaustive list. So there could be other answers that could be considered, but these are the guidelines, the guided answer they would expect students to go along. So you could have said that the healthcare assistant should follow policies and procedures. They should work as part of a team to provide Jason's personalised care. They assist in giving medication and treatments. They could monitor Jason's condition. They could provide personal care and support it, for example, supporting washing and dressing. They could support Jason's eating and drinking and provide advice, emotional support to Jason. Now, if you're not linking to the vocational scenario, you're going to only be getting the level 1 to 2 marks, where you're just generically suggesting ways in which the healthcare assistant can what she is responsible for, just briefly. But by adding more depth, linking to the scenario will get you the higher level 2 and level 3 marks, giving reasoning why would she need to support the individual with feeding. What is Jason's problem? He's not going to be able to feed himself. He's got mouth cancer. He's going to need support. So linking the scenario, just almost sort of like explaining why you've said something, will get you that level 3, 5 to 6 marks. So we've gone through healthcare, we've looked at an example of an exam question in relation to healthcare and one of the jobs in healthcare. Now we're now going to move over to social care. Anything in this next section comes under social care workers. And there is going to be an exam question at the very end that I'm going to expect you to have a go at answering by yourself, considering the example that you've already been given to support you. As you will find with a lot of these slides, I have actually included a lot of YouTube clips that you could go back and have a look at to refresh your memory of the roles and responsibilities of certain jobs. For example, there's one here at the bottom of social workers. Social workers help and support vulnerable people. They aim to make sure the most vulnerable people are safeguarded and are able to live independent lives. So vulnerable people you're talking about are the elderly, those with special needs, young children, people with mental ill health. Social workers can be very involved with children. For example, if there is a child at risk at home from neglect or abuse, they are there to ensure that that child is kept safe and protected from abuse, placed into care, foster care, residential care, to make sure that they are kept safe and protected. Occupational therapists, they fall under the social workers category, social works category. They work with people who have difficulty in carrying out practical routines of daily life. So they may have a physical disability, a psychological illness, they may have had an accident, they may be elderly and struggling to walk. They will work with those people to help them remain as independent as they possibly can. For example, if someone finds themselves suddenly paralysed, end up in a wheelchair, they could go, they could suggest ways in which they could remain mobile. They could go to their house and suggest ways in which it could be adapted so they can remain independent, such as a stair lift fitted, having lower desk tables, work surfaces, wider doorways, ramps into the house. So they do tend to work a lot in people's homes. They can work in GP practices, residential and nursing homes. They are there to help people overcome barriers that they've come up against and suggest ways in which they could overcome them so that they can remain independent and empowered. Youth workers. Now, we're very lucky to have youth workers in our school. We have a youth wing that provides somewhere for young people to go in the evenings and the weekends. They work with children of 11 to 25, although in school they tend to only support those students from 11 to 19. They help you reach their full potential. They tend to work within our youth centres, local schools and colleges. They can be employed by the local council, as are employed by our school. They may also work with children on the streets. They may have to deliver programs relating to people's concerns. They may do programs or advice with smoking, drugs, binge drinking, LGBTQ. They may organise residential activities and projects. They may run sports teams, sports events. It's about working in the community and working with the young people. Care managers are very much involved with residential care homes, especially for the elderly, but there are also care managers for young people and adults with learning difficulties and people receiving hospice care. They're responsible for routine running of the care home, appointing staff, managing staff teams, rotas, budgets, and making sure there's adequate resources in place. They'll supervise the duties of care assistants and overall have overall control of the care home and care setting that they are in charge of. Support workers, quite closely linked to healthcare or nursing assistant, work under the supervision of our healthcare professionals, including physiotherapists, occupational therapists, social workers. They may work with and support social workers. They may help provide support with parenting skills, financial management or domestic skills. Finally, we have care assistants. In the COVID-19 situation we find ourselves in now, these care assistants have been vital in helping our elderly generation to be able to cope with the lockdown, cope with the isolation. They have been there throughout to be there and support these the elderly people. They provide help and support for people who have difficulties with daily activities. They work in a wide range of settings, including nursing homes. They help with personal daily care, washing, dressing, toileting and feeding. They could help with cleaning, laundry and shopping, paying bills, writing letters, advice, support. That's emotional support as well. They could liaise with other healthcare professionals, liaise with other relatives. Now, your task is to consider the slides that you have read, and in particular I want you to think about the slide before this one, which was the care assistant, and to consider the exam question and exam answers we've had previous. I want you to read the scenario, which is Natalie. She's 89, lives in a care home. She has the onset of dementia and struggles to walk without a mobility aid. She is very sociable and likes to join in with activities at the care home. Explain the responsibilities of a care assistant when working with residents like Natalie. So take into consideration everything you've read, including the exam questions and answers, and I want you to have a go at answering this exam question and sending your work via email or Instagram photograph to me. Good luck.